Genetic testing. This project is about genetic testing. What is it used for and what is the pros and cons about it? Genetic testing is a type of medical test which can identify if there is a change in chromosomes, proteins or genes. It is used to understand when a person is having a genetic disorder, and it is also used to monitor the changes in their chromosomes, genes or proteins. There are different methods used for genetic testing. One of the method to genetic test is when you monitor the DNA strings, and when you monitor it for a longer period of time to see changes in it. And another method is when you analyze the chromosomes, and third is used to when you study the level of proteins. It is voluntary to take the genetic test because there is different risk as well as benefits by taking the genetic test. The problem statement in our project is what is genetic testing and how do we use it, and are there any pros or cons for using genetic testing, and it is ethical correct.
Genetic testing uses laboratory methods to look at your genes, which is the DNA you inherit from your parents. Genetic testing identifies changes in chromosomes, genes, and proteins, which can help determine an individual's chance of developing or passing on a genetic disorder.
And now to some pros and cons by using genetic testing. To some, knowing about the body and the risks might serve as a relief. Number two, the knowledge might help doctors making recommendations for future treatment for patients. And number three, this genetic testing could help finding diseases easier. And number four, you can tell prior to a baby's birth if it has any risks or common chromosomal abnormalities, which could help you prepare for those abnormalities. And number five, you could help people making choices in their future, for example, if they should get a baby or not. And number six, low risks of negative impact on your health. Yeah. And now to some consequences. It might be hard. The first one, it might be hard to get answers from genetic testing, and it might be expensive. And the third one, finding out that someone close to you has an increased risk of getting a certain disease might be hard emotionally and might break you down.
Genetic testing can have multiple purposes. For example, some of the first purposes it has served is being used in profiling in crime cases, also known as forensic testing. Back in 1987, a serial rapist was caught after having terrorized 23 women. He got caught since he left 2 fingerprints on a victim's window, and even got identified by one of the victims. There is also multiple death row inmates that got exonerated by the results of DNA testing. Other than crime cases, there has also been other kind of testing, like newborn screening. Right after they've been born, they're being tested for genetic disorders that can be treated early in their life. There is also carrier testing to see if anyone is carrying a gene mutation, prenatal testing to see if there's anything wrong with a fetus, predictive and pre-symptomatic testing. These testing can be used to improve life quality, since you can see from an early age if someone is carrying a disease or some symptom that will have impact on their life later on.
So, if genetic testing is that great, why don't we use it more often? Well, with great power comes great responsibility, which means we have to be careful what we use it for. I mean, sure, it's fine to sort of track down a disease in a family, but then think about it. Now the family has to live with the fact that they are, so to say, wearing a potential dangerous disease that will kill them. However, there is a lot of great things it can be used for, such as in crime investigation and general research for doctors. And also, if you discover a dangerous disease at a very early age, your chances of surviving is even greater, because the doctors and scientists can use the information in research and maybe find a cure for your disease. But for now, it should be considered as a sort of relief instead of something that will save your life.